Hi, I'm Dr. Dan Joseph. I'm the owner of the clinic, and I'd like to introduce you to the regenerative medicine portion of our office, our department of our office. Regenerative medicine, within regenerative medicine, there's terms that we use or treatments called stem cell therapy and PRP, which stands for platelet-rich plasma. And I'm excited to introduce to you our clinical director, Amanda Gwellick, and nurse practitioner, who I going to ask a few questions for and hopefully give you a little bit more insight as to what regenerative medicine is. Amanda, explain to me in your own terms what regenerative medicine is.
Well, regeneration is obviously the opposite of degeneration. And so with this type of treatment options, we are working to rebuild, repair areas of damage or breakdown, and ultimately increase a patient's function.
What type of patients or who's good candidates for this? Like what type of patients are you treating with stem cell therapy and or PRP?
Yeah, so we oftentimes see most commonly knees is very common, shoulders, followed by hips, chronic tendinitises. It can be an old injury or a new injury or a pain that's just been around for a long time.
Maybe explain to me what kind of surprises you've seen with the prognosis or the type of patients you've seen. Have you ever seen anybody avoid surgeries or just explain to me what you see, what's happened with your patients?
So oftentimes the patients that present to me have been through the gamut in regards to over-the-counter medications, steroid injections, hyaluronic acid injections, and a lot of have had the term thrown out to them in regards to a replacement. Offering these type of treatment options, going through these opportunities have taken a lot of that away from the patient. They're not relying on steroid injections anymore. They're not having to take, the Tylenols and the ibuprofens, and even more so, they're not having to make the decision of a risky surgery.
So you've actually prevented someone that was probably going to have surgery or scheduled to have surgery and end up not having surgery?
Absolutely.
And how long does this last? How long do they stay pain-free or improved?
Well, this works different than the base of like a steroid or a medication that you would take. It's not something that would wear off. As we're working to grow something, how long did it take you to wear through that in the first place? And so how much we grow back, and then how long is it going to take you to wear through it again?
Okay, so patients that have had your procedures have had years of relief. It's not like a Band-Aid. They've had relief longer than 6 months, a year, and so on.
Absolutely. Actually, the regeneration process can last anywhere from up to 6 to 12 months in and of itself. And then we're talking years of pain relief thereafter.
I love it. And we can go on and on about some of the benefits of regenerative medicine, but it's too hard to do like this. What we have done, though, is we began giving dinner workshops for the general public. And the purpose of that is just to educate people on what this very progressive treatment is and to find out if they might be a candidate. Unfortunately, not everybody is a candidate for this, and we need surgery, and thank God we have surgeons. But a lot of people we've been able to help avoid that. And so the question is, can we help you? And I don't know that until we see you. Please join us at one of our workshops, our upcoming workshops, or if you cannot attend a workshop, feel free to call the office and schedule a free consultation, and we'll assess you and talk to you and determine if you might be a candidate. If you are a candidate, we'll explain to you how and why and what therapy and what type of treatments would be best for you to help you get out of pain.